So the aim of this session today is to introduce Duchenne UK Connect, which I know that Emily introduced yesterday, so hopefully you have some familiarity with the idea of this platform. But essentially, Connect is a new platform designed to support families living with Duchenne. It's been designed alongside patients and caregivers and will help you to manage your health information, access trusted resources, and participate in research. We're aiming to launch the platform very soon, but in the meantime, we want to share some of our thoughts around why we developed the platform and how that process was done. So today's panel has all been central in the process of developing the platform, and of course, they're the people who we really want to hear from, so I will stop talking and just start sending some questions their way. So kicking off with you, Bouchra, could you briefly explain what Duchenne UK Connect is and the problem it's trying to solve for patients and families with Duchenne?
Yeah, so Duchenne UK Connect is an online digital app and platform that you can use to navigate your Duchenne journey. It's basically a one-stop shop where you can find different tools and information from some of our programs, the Duchenne Care UK program and the Duchenne Hub program. So you can find, for instance, there an interest to participate in clinical research. You can find trusted information and resources regarding care at every step of your journey. It has the so-called In Case of Emergency tool, which was formerly known as the In Case of Emergency app, which is basically health information that you can collect for your child, and it leads to a sort of automated report that when you go into A&E, you can show healthcare professionals that are unfamiliar with Duchenne and they know how they could treat your child. And it also has a so-called registry aspect where you basically fill in different sort of surveys and questionnaires about quality of life, patient-reported outcomes and experience measures, and basically information that is important. And all of this data really helps us as well to look and understand Duchenne a bit better from a patient perspective, and we can use it for like research and development opportunities. So yeah, I've been speaking already quite a while, sorry.
No, that's great,
Yeah.
Thanks, Bouchra. I mean, I get that leads quite nicely maybe onto a question for Michela. So from a clinical perspective, do you think a platform like Connect can do to best support understanding of Duchenne and ultimately patient care?
First of all, probably I'm biased because I will be part of the project, and I was honored to be asked to be the PI for the platform. I think that have a different level. I mean, it can be useful at different level and in different way, both for the patient and more for the patient and clinician community. If I give the clinical perspective, for me, it's difficult to summarize because, in a sense, one thing, for example, that we've done through, and we talk about the Duchenne Care UK project, the ability to monitor how the care is implemented is one aspect, and it's very important for us because it means that what we are doing is resulting in something that the patient experience. And it's difficult to collect this data through the clinician for different reasons. We have a different point of view. We are sometimes busy to report and fill questionnaire about how many of your patient has had a cardiac assessment, how many of your patient, and to have this feedback directly from the patient tell us that actually we reach exactly the target that we want to reach. But even more than that, if we look at the next step, is to see what are the impact of the implementation of care in a patient life. That is what we want to do. And there are different ways to measure the impact of any intervention. And I think that I really see them as complementary and not as competing. So we obviously collect the data in clinic. Most of you know that are completely the North Star database, the North Star functional assessment and the North Star information, which is the clinical database. But putting together the information collected from the clinician with the voice of the patient really make us feeling, are we delivering, and allow us to measure the impact on different aspects of Duchenne. which I think that is critical. So there are things that we do not as clinicians collect, that is what does it mean for a family, what does it mean for a patient, and this is something that we can only learn from the patient community and then will improve the care. Then is I mean, I can talk for hours, because I think also we talk about the central recruitment database that has been a project that has been operating for many, many years and has been very effective. I hope that has been effective because FEL reached the objective to make research more accessible across the country, but has also been a very useful tool for us as a clinician, that when we need to recruit for clinical trial, we have a better idea about, is this study deliverable in the UK, and where can we reach patient that we might not have available in our clinic. So it's an incredible tool. And then the third part for me is that is linked with the care is the registry component. So when we collect information that is more about, again, your experience with Duchenne and your experience with care, will really help us to understand the natural history of the disease. And I think that the UK is in an amazing opportunity here to put together the clinician voice and the patient voice to really understand this condition and what is needed.
Thank you, Michela. And mentioning the patient perspective, I think, is again a nice segue into the next question. So, Alex, you've been involved in shaping Connect from a parent perspective. What was it that made you want to be a part of this project, and which aspects were most important for you?
I think one of the most important things is that from a patient perspective and a parent perspective is that we'll be the ones that be using this on a daily basis. We'll be the ones that will be needing to access it, input the information, and get the information out of it. So it was really important that the parent impact and input into this project was very clear, very concise, that we were able to say, we need to be able to access this information, and this needs to be easily available. This is the stuff that perhaps needs to be a bit of a deeper dive that we can go into, and this is the depth of information that we feel we can give as parents. The other thing is having something like this, and I think, and Bouchra mentioned the in case of emergency aspect of this, is so important. I have attended webinars, listened to Jared speak around adrenal insufficiency and what to do in an emergency, and then had that moment where you've got to go to A&E with your child and gone, I can't remember what to do now. And it's always on a Friday night, a Saturday afternoon. It's when your neurologist is on holiday, and there's no, it's then a panicked phone call to another parent or Alex, or and actually it was so important to have input in this, and this is one of the major aspects, is that actually in your hand, in that app, is the ability to go, there, that's what you need to do, this is what my son is on, this is the impact it'll have, you need to make sure that you care for him in this way, because if you don't, you'll have a much more adverse impact, and it takes that anxiety away from you as a parent in those really critical situations. So it was so important from a sort of a parent aspect to be able to say, this is what our boys will need, and it's been a real pleasure to be involved in the project.
Great, thanks, Alex. And I think this sort of co-development alongside the patient community, it speaks to the importance of trust, I guess, between those developing these sorts of tools and patients. So, Bouchra, I wonder if you could quickly speak to how Duchenne UK Connect has been designed, specifically around how it's designed to safeguard the information that families are putting into the platform.
So first I want to give a massive thank you to the patients and families that were involved in designing this platform together with us. We had workshops designing this platform, and we really asked, what is most important to you, and what kind of choices do you need? So trust is really vital, within this project, but all of our projects really. And you can choose within this platform. It has different modules. I mentioned sort of documents, the in case of emergency, registry, and you can choose where you want to save your data. You can export it. We adhere to all of the GDPR laws, and you are really in charge. So you can, show your interest, for instance, in participating in clinical trials, but not participating in, for instance, the registry aspect, because you might not feel very confident doing that. So the choice is it's all in your hands basically. But also you can export your data. You can share it with your families, with grandparents. You can choose what you want to share, for instance, with like schools. So yeah, that's it. I
Great,
think
thanks,
in a
Bouchra.
nutshell. Yeah.
And I guess in a similar vein, on a clinical perspective, Michela, building a platform in a transparent way like this, why is that so important from your perspective?
Again, for different reasons. I think that as a clinician seeing patient in clinic, one important aspect is the transparency of the accessibility. So all of us are different, and all of us change with time in our life. And probably even more as a parent of a child with Duchenne. And having the possibility to pick and choose based on your interests, based on what you're ready to, and of the time is fundamental. But it's also true that, and I think that will be silly to deny, that data are important and sometimes are power. And having that transparency and the confidence about what your effort in providing the data, because we complain about the busy clinician that struggle to provide the data in their routine clinical appointment, but also for families, you are all busy. So make it clear that the effort in entering the data and contribute, what does it mean, what does it bring to, what is the result, what do we do with this data, what is the impact of you spending not hours, but minutes, in completing this question, and have an impact. I think that is something that we all absolutely need. And also being transparent that everything that we do, and I really extend this to any activity that we jointly do with Duchenne UK, is really done on the interest of the patient and with the priority of the patient. There is no other interest there. And I think that we all know, but it's important that the platform is built with this in mind.
Great, thank you, Michela. So going back to, you mentioned impact, which of course is hugely important, and we're hoping that the platform will have a massive impact. Really quick question to the whole panel, I'll start with Alex. So in a couple of years' time, what do you think success will look like for Connect?
I think success will be a massive uptake from every single parent in this room. So I encourage you to scan the QR code, stay in touch, make sure when it is launched that you download, you input the data that you can input, okay? You are always wanting to advocate for your child and do something, but we're all at a different place in our journey. This is an opportunity for you to advocate for your child in a silent way by inputting data and having data available, not only for clinicians, for the hub, for yourself in an emergency situation. So it is a perfect opportunity for you to do an effortless advocacy, is what I'd call it. It's a perfect opportunity. You don't have to be out there. Do the dash, but you don't have to do the dash. This is a great opportunity for you.
Yeah, how to top that, right? Yeah, I would say I think the most important is that people feel also empowered, that they have all of the information, that they have the care guidelines with them, that they can ask clinicians the questions as well, because they know what type of care their child should receive. It's about utilizing that data for like research and development opportunities to understand Duchenne better from a patient and parent perspective, because data is power, and we need to have that data to show what your lived experience really is. Because most of the time you see your clinicians maybe once every 6 months or so, sometimes faster, but then you never know what happens exactly in 6 months. You know your child best, and you know what happened. And I think you have that information there, and you can actually just show that as well and discuss it.
For me, inclusivity. So it's really an opportunity that is accessible and that's been built with the patient in mind, by patient, and I would like to have all patients represented. And this means different age, different background. I think that this will be a big achievement. I would like to see an improvement of care. So we've been working with the Duchenne Care UK project for a long time, and I would like that the platform will give us the opportunity that actually is another instrument to improve care for all, so across the country, wherever you live. And the other big achievement would be if we start using the data to really open our mind on what is important and where new gaps are, and this in terms of care or in terms of research.
Great, thank you very much. And one last closing question for Alex. So for parents and families that are hearing about Connect for the first time today, do you have any sort of final message for them?
I'll just reiterate what I said earlier. I think it is your opportunity to really be massively involved in the care of your child beyond that 6-monthly neurology appointment or your cardiology appointment. It is something that you can do on a potentially a daily basis, but you have an opportunity to have an impact on research outcomes, on clinical outcomes, and on care standards without having to stand up in front of a group of people and talk about your experience. You can do it quietly from your own home. So please, scan the QR code, get it downloaded when it's launched. You can have an impact.
Great. Thank you very much. Thanks, everyone.